Hello there. Welcome to EON Reality's webinar about the application of virtual and augmented reality in medicine, healthcare and patient care. Thank you very much indeed for joining us today. If you have any ideas, questions or discussion points during this webinar, please feel free to use the chat function, raise your hand or ask a question in the GoToWebinar menu panel. My name's Jane McConnell and I'm Marketing Executive at EON Reality. So let's get started. EON Reality is the world leader in virtual and augmented reality solutions for a huge number of sectors, and medicine is one of our biggest specialist segments. Over the last 18 years, we have developed so many VR and AR solutions, one of which is this, the Human Anatomy Builder, which you can see on the screen now. And we've created solutions like this for many clients, such as the following. Our apps are used by practicing organisations, doctors, educators, nurses and healthcare professionals right across the globe, and we have 18 years of experience in this field, innovating and creating high-level advanced solutions. So today we will be discussing the application of VR and AR in medicine and patient care. So we're going to be covering the following topics: where virtual and augmented reality is used within the medical sector, how that technology is currently implemented across the sector in training, VR and AR in diagnostics and patient care, the features and benefits of immersive learning, we're going to be covering those as well, the challenges and future issues that we face in training new medical and support staff, and I'm sure these are some of the things that you're going to be very aware of as you're watching this. And finally, we're going to be talking about where VR and AR will be applied in the future. So the current and future potential applications of VR and AR within the medical sector is and will definitely continue to change and evolve the way that healthcare professionals train at almost all levels. And here at EON Reality, we regularly consult with professionals in the industry, and as a result, we have developed a huge number of core learning and training applications designed for medical students, doctors, trainees, and healthcare professionals who are very much continuing their professional development. And in some cases, they themselves will be learning new skills too. In regards to this, we spoke to a certain chap called Andy Anderson, who is the CEO of the Association for Simulated Practice in Healthcare. And from what he says, it's clear to see that the need and the demand for advanced, smart and cost-effective immersive training is growing massively within the healthcare provision and in almost every aspect of healthcare.
Yes, indeed, and we do need to be mindful of the fact here that simulation, particularly and very much with VR and AR, it's applicable right across the healthcare spectrum. So we tend to use the word healthcare training and to make sure that all of the potential applications of these technologies are explored, because if we expand it to the widest possible community, that would include patients. Educating patients, I think, has got another massive potential in terms of helping the patient and the medical professional come together and work as a team.
Our developers and producers are at the forefront of VR and AR in almost every continent, and in creating these solutions, it means our teams truly understand the variety of challenges faced when it comes to training. And some of these challenges include textbook learning, which simply isn't immersive enough. We're working with human bodies, animate creatures, so 2D learning doesn't really suit a 3D subject. There's the cost of blended learning, which can take up a lot of time, a lot of planning hours. There can be a very heavy reliance on trainees to take work home, which in a flipped classroom is very much appropriate, but that reliance can be on paperwork, which in 2017 isn't really the best method. The time available and cost of practice for practical work. So here we're talking about obviously simulation models, cadavers, and the kind of equipment that costs thousands of dollars, of pounds, of euros every single year. And in running these kind of simulation classes as well, there's usually another cost on top of that. The large amount of information that needs to be absorbed in a relatively small amount of time. And there can be quite a heavy reliance on actors. So again, in these simulation and practice environments, these heavy mannequins and cadavers are quite costly if they have to be transported. Again, it kind of adds an extra inconvenience in training, which can be streamlined with VR and AR. So for something a little bit different, let's take a look at the creative methods in which augmented reality is actively being used in patient care today. The following educational item of news footage is from the BBC, and this shows AR being used at Sheffield Hallam University in England.
And that's what the students here are finding. This app consists of varying setups that have been recorded by actors to put a person's face and an image of a person's distress in their mind.
It's getting worse. It's been bad all night. If you could just sit me up, I'd probably be a bit better, but oh dear.
Once the introduction has been made on the tablet, the mannequin can be remotely controlled from a computer to continue reacting in keeping with the scenario. Of course, live actors could be used, but the lecturers here believe that the recorded performances allow for a more cost-effective and consistent way of learning.
These students interact quicker and they interact more often.
So the example which you just saw used a mannequin and AR. Virtual reality and augmented reality, as just shown there, can provide empathy training as well as technical training by using avatars with markers, invisible markers, immersive environments, and quite clever overlays as well. So an example of this from EON Reality is our recent work with the National Health Service in the UK, which is one of the world's top 5 employers and trainee organisations. What you can see on the screen now is an app we developed for them, the Chest Emergencies application, which is an AR training app used daily in the NHS in the UK. It was designed by our development team in collaboration with NHS Health Education England, which comprises professors, working surgeons, doctors, nurses, and our world-leading development teams too. The app helps identify visually complex diagnostics in a matter of seconds. It removes the need for constantly reviewing textbooks or even paying for access to training rooms after hours. The app provides refresher training anywhere and at any time. Another challenge can be how this technology is understood and appreciated by some of your colleagues who, in truth, may not understand or like VR and AR. We spoke to Dr. Alan Gopal, who's an innovative healthcare professional, and he's a board member for the Association for Simulated Practice in Healthcare. He had this to say.
I don't think there's a barrier. I think obviously you've got different clinicians will have different viewpoints and different varying amounts of resistance to new technologies and so on. But you currently have some very switched on clinicians coming through the ranks or consultants now and so on, and they want to use this. They've grown up with this. They see the power of it in their everyday lives, and they want to bring that to the place they work in, the place that they enjoy working in. And no, I think definitely there's a massive appetite amongst clinicians. It's finding the right ones who want to do it in the right way, as well as it's that simple formula of input-output. If we do it right, then we put the right amount of investment and so on, the right amount of expertise, and making sure it's designed exactly so it's fit for purpose and so on, and then actually using it in the right way, so getting it out to all the trainees that need it, and actually just seeing exactly what's going on, measuring the outcomes.
The ways and mediums with which professionals and patients learn is changing rapidly, and it's exactly these kinds of learning outcomes which are vital in measuring and proving the usefulness, effectiveness and efficiency of augmented and virtual reality training. And we know that there is really an immediate need for faster knowledge transfer. Medicine is one of the fastest changing sectors, and by this we're all aware of how quickly research moves on, how much it can affect the way that we practice and what we apply. Professionals at all levels have a requirement to be up to date on these new developments, so it's very much learning on the job and learning constantly. So faster ways to do this, more convenient ways to do this with the technology that we already have. We have smartphones, tablets, and what we use in the office. And this is only going to grow as a need as medicine and patient care becomes more and more advanced. When it comes to patient care, symptom identification, physician behaviours, and understanding how all the different systems in the human body fit together, there's a very heavy reliance on actors, real cadavers, and organs, and costly, heavy mannequins to practice on, which I mentioned at the start of this webinar, which obviously forms or can form a very large expense and be wasteful if students aren't learning quickly enough. For example, the cost of mannequins are usually around $10,000 each, and an eye or a head alone can cost over $1,000. Now, multiply these with the thousands of different types of simulation mannequins that are being bought and used and then replaced sometimes every 12 months or even less by healthcare organisations. The costs for a training provider in the sector can add up massively in a year. Now, mannequins and models and even cadavers, they're definitely a rite of passage when it comes to medical training. But one of the things is that they're dead or they're inanimate. So while traditionally medical professionals can see everything in the flesh or in simulated flesh or in the plastic, they can't see how it works or moves when it's alive. Augmented virtual reality animates this, and VR and AR apps can be created with such accuracy and photorealism that elements like circulation, muscle twitching, and the human nervous system can be viewed as if in real time, right in front of students and trainees' eyes. And this is the kind of thing that we tend to talk about when we say that we're revolutionizing medical training. There are so many use cases which demonstrate just how productive and user-friendly VR and AR applications are when it comes to increasing the rate of knowledge transfer, the effects on long-term memory, the retention of knowledge, and the incredibly engaging way in which VR and AR teaches and trains people across the world without waste or endless high cost. What you can see now are selections of clips from an app called iSim, which is an ophthalmology application which saves thousands and thousands of dollars in textbooks teaching exactly the same material. Increasingly, these kinds of costs can be shouldered by students and trainees themselves, but this can have the knock-on effect of restricting student attendance and reducing retention. iSim was developed by EON Reality together with Dr. Anuradha Khanna from A New Reality. It's an ophthalmic virtual simulator for medical educators to utilise in a classroom for knowledge transfer and for learners to achieve mastery learning via live visual practice, which is completely interactive on mobiles, desktop, the iBench and in VR. The unlimited hands-on practice and 3D real-world learning help students learn faster and memorise what they've seen and learned for longer because they've experienced it rather than simply reading about it and looking at flat pictures. Okay, So what I'm going to show you now is a video exemplifying the whole idea of bringing learning to life and exactly what our 3-tier augmented virtual reality platform AVR is and what it's capable of. That definitely exemplified many sectors which utilise augmented virtual reality, but let's focus one more time on how these connected platforms can produce an easy-to-use, smart training system for medical practice. The first part of our 3-tier platform is the virtual trainer. This allows people to connect in. Users can train and fine-tune their learning immersively with Virtual Trainer, whether they're in the training centre or in any connected room in the world. It can massively reduce the room hire needs, training and delivery costs where programs have to run across a number of sites, or where there simply isn't that much free space available. And we find this is usually the case in busy hospitals and surgeries where practice rooms are active and really have to be used daily with patients. Virtual environments offer photorealism, and with this in Virtual Trainer, you can connect your whole learning community into your learning management system with real-time training, live recordings, and recorded outcomes, which are endlessly helpful for busy practice managers who have ever-changing teams to train, manage, and assess. The second part of our 3-tier AVR platform is our mobile and CMS application, Creator AVR. This is incredibly useful. It's a time saver and it empowers medical professionals to actually create their own VR and AR apps without needing to know how to code. Creator AVR empowers you as busy trainers to connect all your trainees with the materials and their learning journeys across loads of mobile, wearable headsets and desktop devices. So that means trainees can progress the same learning journey when they are out and about, helping them train on the go, outside, at home, or on the move. And you can check in on how they're doing through live and recorded analytics. The third part of our 3-tier platform is AR Assist. Wearables like the HoloLens, ODGs and others, the medical sector can easily leverage these into a mixed reality environment which is increasingly being experimented with and actively used. For example, in training up young gynecologists or even heart surgeons before they even approach a human body. So even if they're not in the operating room, they can still connect to a high-level, smart and cohesive training program. And EON Reality Reality are developing an AR kit and AR core at the moment, so that mobile versatility of live assistance is on its way too, which is really exciting. So we're going to zone in a little bit more on Creator AVR now, and the best way to talk about it is to show you. So I'll hand you over to our fantastic business development director from EON Reality UK, Eamon Watson, who is going to take you through one of the staple lessons in Creator AVR, which is a basic heart anatomy lesson. Over to you, Eamon.
On to the final section of our webinar today, where we're going to take you through a pre-created lesson of the human heart. This is built in the EON Reality AVR platform, and this can be customized for any part of the anatomy or indeed dentistry or any other part of medical practice. But using the heart, it's a nice, easy way for you to understand some of the functionality that we can bring to experts in their field and allow them to overlay that with their own knowledge. We'll show you in a moment how easy that is to do. So if we start the lesson now simply by hitting the button on the right hand side, what you'll see is there is a model of the human heart, and that can be zoomed in or zoomed out accordingly and rotated around so that the student can get a full understanding of the model that he or she is working with and provided to them by the expert in their field. Now, there's an awful lot of different functionality that we can walk through with the heart. Let's show you, for instance, how you might want to see an X-ray view of any particular model. And you can see the translucent form there of the model, and again, get a better understanding. It may be that the student wants to see the component parts that make up the heart. So let's now see the heart split into those component parts by hitting the explode button. And of course, an expert can annotate. He can annotate with video and link into a YouTube seminar he may have done on a particular issue. He can annotate with text, or he can just simply label up some of those different parts of the structure of the heart. When the student sees the plus sign, he knows that additional information is hidden in behind there and can interact accordingly. Now, when the students become familiar with the initial part of the lesson, we can ask them then to assess themselves so that we now move into the area of accreditation that we were talking to Andy and to Alan about a little bit earlier, and capture those learnings so that we could say to somebody, can you find something? Can you build something? Can you answer the questions to prove that you have the knowledge? So let's go into our quiz mode maybe initially and show you how that would work. Now, the level of the questions and how they can be set is very easy to be input by anyone with PowerPoint skills. You can do that direct from the app, and you'll see in a moment here a question comes up with a multiple choice offering. Now, if the student gets the question right, you'll see in the top right-hand corner of the screen that there's a scoreboard. This can be used for accreditation and put into a learning management system and be used to accredit the student. In this instance, he's got the first question wrong. But if he has a second attempt, you'll see live there that his score has now been registered. And obviously the fact that he got the question as well initially will have been added into the learning record store too. So let's maybe look at how we would perform a dissection of the human heart in augmented reality mode. You'll be able in a moment to see that the heart has appeared over the table here. Now, not only can I examine that or indeed perform the previous functionality that you've seen with X-ray or with exploding, but I could also perform a dissection. And you can understand how this is really going to grab the imagination of younger students who have grown up in the digital age and aren't really expecting in-depth textbooks. If you can link this to YouTube and additional information and to manuals or operative instructions, then you can understand how engaging this is going to be. Once we've delivered an AR or a VR project, we can work with any institution to enhance in a fully scalable method a full module that we can then accredit students having passed through in our AR or VR mode.
By bringing 3D content into the real world, together with experts, we are really helping to revolutionise medical training. I really hope you enjoyed this webinar, and thank you very, very much for watching and staying tuned in. Don't forget, you can reach out now with any questions in the GoToWebinar app. Simply raise your hand or write in that chat box. Or maybe this has sparked some ideas of how you can implement virtual and augmented reality into your practice or medical training programme. Visit us at eonreality.com, or you can contact me directly if you like. It's Jane, that's JANE .McConnell, MCCONNELL at eonreality.com. Thanks again, and I hope to speak with you soon.